First up, though, let's talk about NHS waiting list. You can't talk about the NHS about anything unless it's about waiting lists. Or unless there's a serial killer, a nurse amongst their midst. But we've seen some extraordinary figures on waiting lists, where extrapolation of figures by Labour based on a quarter of NHS trusts returning freedom of information requests suggests that hospital waiting list deaths have doubled in the last 5 years, with more than 120,000 people dying while waiting for NHS treatment. This while NHS waiting lists are at an all-time high at 7.6 million. Let's talk to Roy Lilley. He's a former NHS Trust chair and joins us now. Good morning to you, Roy.
Good morning.
Thank you very much for joining us. Look, I mean, I'm very happy to bash where I think any public organisation is doing things wrong, but it is perfectly possible that someone could be on an NHS waiting list for, I don't know, an operation on bunions or something, and then to die of something else, cancer, heart disease, whatever, whilst on that waiting list. But it doesn't mean that the wait for that operation has killed them. So can we read anything into these waiting list deaths?
Yes, I think we can, Julia. I mean, I remember having a conversation with you some months ago where I said if this carries on, people will die waiting. Yeah. And they are. And you're right. I mean, some of them will be very elderly and maybe passed on through, natural causes, something unrelated. But I don't think you can disengage the fact that people are waiting for treatment, a lot of it very serious and a lot of it for quite sinister things, where they do die. And now, what do they die of? Well, that's a much more sophisticated piece of work. And the Labour Party, to an extent, have jumped on the bandwagon. But I have no doubt in my mind that a lot of the people that have died will have died as a result of waiting for treatment. And we're seeing, I think a couple of days ago, the Department of Health released some numbers that 45,000 people missed appointments during the 2 consultants' days of strike. And, these consultants, they're not stupid. These aren't, first-year medical doctors or young nurses or whatever. These are older, experienced people who know exactly what they're doing, and they know that they're putting people with clinical priority, that because they've come to the front of the waiting list, and they're just saying, no, my wages are more important.
I mean, elderly relative of mine had a couple of appointments moved because of this. We're talking about being moved to December. Moved from July to December, for goodness sake. I mean, not by a couple of weeks, because those next couple of weeks are completely chocker as well. And that is extraordinary. And we know it's very, very simple. For things like cancer, every 2 weeks delay is an extra 5% chance of you dying. I mean, these are... you can literally, estimate how many people will die. Carol Sikora recently was saying that, the cancer specialist, that, we haven't even begun to see the deaths from cancer yet. We're seeing excess deaths right now, and we're seeing them from younger people than would be the average age of death from COVID, which was, in your 80s. You're looking at people who are dying in their 40s, 50s, 60s. They're dying of heart disease, diabetes and things like that. But the cancer deaths we haven't seen yet en masse, because these are people who would have been would have gone to the doctor in 2020 or 2021, didn't get an appointment, didn't get a referral, didn't start treatment, coming forward in the last year or so, and now maybe starting treatment. But actually, for a lot of people, that treatment's too late, and now they are got an 80% chance of dying rather than 80% chance of living, and those deaths are going to come down the line.
Yes, you're right. And the National Audit Office released some numbers, I think, a couple of days ago, where they're talking excess deaths. Now, this is where we take a 5-year rolling average of expected deaths and compare it with what the actual deaths are here and now. Now, those numbers have been pretty unreliable because of COVID. The numbers have been distorted, but COVID is kind of tapering out of the system. We're seeing the excess deaths, are starting to go up. So there's no question about it that delayed care is dangerous care. And it's not just cancer, as you say, it's cardiac, it's even blood pressure. If you don't get treatment for blood pressure quickly enough, properly enough, you could end up having a stroke. You have a stroke, and then that's your life down the pan. This is really serious, and that is why the doctors, when they go on strike, are saying, "Oh well, the blue light front door will be there. We'll look after you if there's an emergency Christmas Day service," but they deliberately turn their backs on the people who are on the waiting list, and they're not on the waiting list for fun.
No.
there because of a clinical priority. They're being ignored. It's dangerous. I think it's, frankly, for the consultants who are earning 80 and 100,000 a year, I think it's thuggish behaviour. And frankly, I would question their registration with the GMC, because this is not what we expect experienced doctors to do.
I think people have the right to strike. I think it's a really important right. I just think they're not reading the room. I really think they're not reading the room in terms of where the public are. And indeed, when you're on those sort of salaries, you know, they're going to be getting a pay rise. Most people haven't had an inflation-busting pay rise in the public sector. And again, we need to see greater productivity. All the extra money that's gone into the NHS, we have not seen them improve. In fact, productivity has gone down in the NHS since 2019. Yeah. Even after COVID, even when they're doing all these extra operations, they're still not doing as many as they used to. Roy Lilley, always so good to talk to you. Great to get your analysis, such expertise. Thank you very much, former NHS Trust Chairman.